Welcome to the Journal Club for this week. This article titled The Impact of Calcium Silicate-based and Resin-based Root Canal Sealer in Post-Operative Pain and Sealer Extrusion. It's a multi-center randomized clinical study which was newly published in the JOE. Post-operative pain remains a critical concern in endodontic treatment, which were influenced by several factors, including the choice of root canal sealer. The severity of post-operative pain is closely linked to the chemical composition of the sealer, which determine its biocompatibility to induce inflammatory reaction upon contact with periapical tissue. So this study aimed to compare post-operative pain level between bioceramic sealer, new sealer flow, and AH plus sealer at a different time interval, 24, 48, and 72 hours, using a visual analog scale, and to investigate the effect of bulbal diagnosis and sealer extrusion also on the post-operative mode. Furthermore, this study will evaluate the influence of sealer extrusion and apical periodontitis in post-operative pain by applying a general linear model to detect the statistically significant difference over time. So for their material and method, the study include patients having anterior or posterior teeth that require root canal treatment, which were categorized based on the bulbal diagnosis. They include asymptomatic irreversible pulpitis, pulp necrosis, and previously treated cases with no or asymptomatic apical periodontitis. The exclusion criteria include medically compromised patient, teeth that require extraction, immature permanent teeth, patient under 18 years of old, and a patient who has advanced periodontal disease, root fracture, and cases that could not be done in a single visit. They did randomization, and patients were divided into two groups. The first group received AH plus sealer, and they did the obturation with a warm vertical compaction, while the other group received bioceramic sealer and the obturation done as a single cone. Each case was done by a single operator in each of the 5 centers, and all of the operators were calibrated before the start of the treatment. After that, all the patients were contacted either by calls or messages to report their pain level at 24, 48, 72 hours, and the pain intensity was recorded through the VASA scale, which ranges from 0 to 10. 0 represent no pain, and 10 was indicated for the maximum pain level. The score classified into 3 categories, which is mild pain, moderate pain, and severe pain. Also, the post-operative pain in cases with extruded sealer, they were checked also with the VASA score. So the result of this study, the incidence of post-operative pain and the pain level both were higher in the AH plus group in compared to the bioceramic group. The pain decreased in both groups at 48 and 72 hours with no significant difference. The sealer extrusion occurred in 44% of the cases, and it was more frequent with the bioceramic group with an incidence of 50% in compared to the AH plus with an incidence of 37%. However, the higher pain intensity was recorded with the extrusion of AH plus sealer group. The cases of pulp necrosis exhibit the highest pain level, while the previously treated cases had the lowest pain. The general linear model and the logistic regression model both confirmed that the use of AH plus, the sealer extrusion, and the presence of apical periodontitis are the 3 most predictor for post-operative pain. So to conclude this study, the bioceramic sealer was associated with lower post-operative pain at 24 hours, despite the higher extrusion rate happen. The sealer differences diminished over time, indicating that both AH plus sealer and bioceramic sealer provided a comparable long-term clinical pain outcome. And thank you.